So some of the current trends for managing osteoarthritis and veterinary medicine in general are, if we kind of go back at the very beginning, I think we've done a pretty poor job managing osteoarthritis in general as veterinarians. And so the way I try to approach it is, if I have a patient that has a primary problem and may develop osteoarthritis, or maybe they've already had that primary problem and now they have osteoarthritis. And so if we go back to the first group of patients, typically what I like to do is establish what I call my baseline. And so in dogs, particularly, osteoarthritis is typically secondary to something else. So the first question we ask ourselves is, can we get that primary problem under control to slow down and minimize progression of osteoarthritis? And sometimes that's possible. Sometimes it's more management when it comes to things like elbow dysplasia, for example. And in those situations, for establishing our baseline, what I like to do is start with our joint supplements, as well as our omega-3 fatty acids. And those are important, but not the end-all be-all. Probably the most important thing is daily exercise, as well as maintaining appropriate body weight. But the big kicker is it's impossible to maintain appropriate body weight if you can't have daily exercise. And to have daily exercise, they have to be comfortable. So the whole goal is, what can we do to make them comfortable so they can have that daily exercise? And again, exercise is not going to be running around in the backyard chasing squirrels. It's going to be getting out, going on at least twice daily 20-minute leash walks on flat ground. I think every dog should be able to at least handle that aspect of things. And if they can't, we need to figure out why. And in many situations, if they are a patient that has osteoarthritis and now they're having clinical signs associated with it, many times we consider this to be a flare-up. Just like in people, we have periods of relative calmness, and then we have periods of flare-ups. And during those flare-ups, it's going to be an acute exacerbation of clinical signs. And so in those situations, we take a step back and say, well, what do we do to get that under control? And this is going to be where some of those current trends come into play. It may be that we use pharmaceuticals, but the goal here is to use them at the lowest dose possible, as infrequently as possible. We, as a profession, we've got to move away from the, here's your anti-inflammatory and your tramadol, and that's all we can do type scenario. Maybe it's going to be things like physical rehabilitation, where we can take the load of the stress off of the joints, but still maintain active muscle contractions to maintain range of motion, minimize periarticular fibrosis, minimize inflammatory changes. It may be that we look at doing things like intra-articular injections, which are utilized quite commonly in people and in horses, things such as steroids, or hyaluronic acid, or even the concept of regenerative medicine. And what falls into regenerative medicine would be either platelet-rich plasma or the combination of stem cell platelet-rich plasma. So there are a lot of avenues away from just using pharmaceuticals that we can manage these patients to get them comfortable. And so during those periods of flare-ups, we do whatever is necessary to get them comfortable. So for me, many times that's reaching for either our pharmaceuticals or our intra-articular injections, along with formal rehab. And then once they're comfortable, we get them back to their baseline. And if they ever deviate from their baseline, then we take a step back again and say, well, what do we do to get that under control? And it's always ever evolving. It's multimodal. What works at one flare-up may not work for the next flare-up, which means we may have to always be evolving and changing. And really what we have to do is take a patient-centered approach rather than just a basic cookbook approach.